But it appears waiting lists for opioid addiction treatment may be getting shorter.
That's because more health professionals are now allowed to prescribe buprenorphine. It's the main ingredient in Suboxone. 9 on Your Side's Brianna Malloy is live in our studio now. And Brianna, tell us more about these changes.
That's right. There's been a lot of rules about which health professionals can provide medication-assisted treatment and how many patients they're allowed to treat. Well, now Senator Brown's TREAT Act opens that up by saying it's not just doctors who can prescribe these drugs, but qualified nurses and physician assistants can too. Today, I spoke to one patient who told me what this could mean for people waiting for treatment.
Stressful, I get that.
Right.
Jeff Hawkins remembers when he realized opioids had taken over his life.
My rock bottom was we were going to lose our house, and I had to borrow 2 house payments.
It was then that he called a doctor for help.
There was no openings, none whatsoever, and she had told me that sometimes it takes a very long time to get in.
For Hawkins, it took 2 months. What could 2 months mean?
Death. Somebody who really, really needs help, somebody who really wants to turn their life around. And if they can't get in and get the help when they need to, they're rock bottom, it could be death.
Hawkins' doctor, Mike Kalfas, remembers when Suboxone was first released. But in the beginning, an entire practice of doctors could only treat 30 patients.
And you can't call my office and get an appointment, or you can't call my clinic and get an appointment, then there's a problem.
In the beginning, the drug was limited because side effects were still unknown. But as doctors learned more, legislation loosened up. Now qualified nurses, physician assistants, and doctors can all treat 275 patients each. So why doesn't the government just get rid of the limit completely?
Yeah, I got mixed feelings about that. I mean, part of me wants to say no cap, but then again, I will admit there has to be safeguards in place to make sure that physicians are cautious with the use of something like this.
As for Hawkins, he's hoping the new law will help more people get the treatment he got.
Well, Suboxone has been great for me. Like I said, it's totally turned my life around.
And I also asked the doctor how loosening legislation could affect Suboxone that's illegally sold on the street. He believes it will help the problem since that market is fueled in large part by people who are not able to get in for treatment. Brianna Malloy, 9 on Your Side.